IVF is the fertilization of an egg outside of the body. So sperm gets into the egg, and sperm and egg nuclei get together to form an embryo. So normally, naturally, egg and sperm meet outside, inside the body, in the tubes. But in the vitro fertilization cycle, we collect eggs and collect sperm, inject sperm or wait sperm to get into an egg. That's so-called in vitro fertilization. There are mainly three steps of IVF. First step is to induce ovulation or ovulation induction. The net rationale behind ovulation induction is to get as many good eggs as possible. Again, naturally, a woman produces one egg each month, but our aim is to get as many as 10, 15 eggs out of ovulation induction. Then the second step, to collect these eggs. We do it under sedation, taking like 10 minutes to get all eggs to aspirate the follicles, and we inject sperm into the egg to get embryos. This is the second part. Then the third part is to transfer the embryo formed outside. 3 to 5 days after the egg collection, we do transfer the embryo into the uterus and wait for the pregnancy. So the first step is to induce ovulation induction phase. The second phase, to collect eggs out of the body, and the third phase is to transfer the embryo into the uterus. All injections or medications in IVF are used in purpose of stimulating follicles, stimulating egg collection, egg production in the body. So unfortunately, tablets are mild stimulants and not worth using tablets in an IVF cycle. We do use injections to stimulate follicles to get as many good eggs as possible. So that's a crucial part to use medications in a correct way. It usually depends on the age of a woman. Under the age of 35, the success rate per cycle is about 40 to 50%. But after 35 to 37, it drops to 35-40%. After 40 years of age, it drops dramatically down to 15%. So age is very important when we consider the pregnancy rate through IVF. ICSI is the conventional. In conventional IVF, we do leave the sperm beside the egg and wait sperm to get into the egg. This is the conventional IVF. But in the ICSI cycle, ICSI cycle, we do inject sperm into the egg and wait for them to get together and develop blastocysts, develop embryo. So it's the ICSI is the injection of sperm into the egg. There's a range of indications to get advantage of IVF. Mainly, the male factor patients are good candidate for an IVF cycle. The other one, polycystic ovaries patients having irregular ovulations might benefit from IVF. Endometriosis, another indication for an IVF cycle, which causes tubal pathologies. So tubal pathologies is another strong indication of IVF cycles. And lastly, the unexplained infertility couples having tried to get pregnant for at least 2 to 3 years and didn't get pregnant with not specified or not an absolute cause. These patients are classified as having unexplained infertility, and they are very good candidate to an IVF cycle. Yes, there are some absolute things to increase pregnancy rate through IVF. The first one is to having normal body mass index. That's important because excessive fat tissue, if you are overweight or obese, Excessive fat tissue may disturb your hormonal environment. The second one is stop smoking and reduce alcohol intake, have regular thyroid function and regular blood glucose levels. These are the main points to increase pregnancy rate through IVF. There is no specific recommendation after embryo transfer. In the past, we used to recommend couples or women to stay in bed for at least 2 hours or more than 2 hours just after embryo transfer. But now we quit recommending this this way. We just you can stand up and go to your work or get back home as soon as you got embryos transferred.